thank you for joining us for the 47th Annual AAKP National Patient Meeting. My name is Lisa Baxter. I am an AAKP Ambassador for the state of New York. I'm also a kidney patient. I was diagnosed with polycystic kidney disease. After 12 years of dialysis, I got a kidney. As a kidney patient advocate, I have shared resources and tools, with other patients while spreading kidney awareness. Being part of AAKP allowed me to learn, allowed me to grow, as well as mentor other dialysis and transplant warriors. As a founder of Blessed Kidney Connections, and the producer of the Lisa Baxter Dialysis Reality Transplant Show, I am so pleased to moderate today's advocacy and engagement and training session on how to make social media work for you and the organizations you support. Through the AAKP, for Patient Engagement, Advocacy, and Center for Patient Research and Education, the association is dedicated to engaging and training kidney patients in ways that are most effective at elevating the patient's voice and providing practical skills they can implement throughout their kidney journey. And today's session does exactly that. We are honored to have with us Mr. Luke Schneider, managing partners of Alter Valley digital and marketing and communications firm that specializes in press operations, issues, advocacy campaign, marketing, and multimedia productions. We are pleased to have Luke with us today to provide us with some tips and best practices on how to be effective on social media for our advocacy purposes and those of the organizations we support, such as AAKP. Welcome, Luke. I turn it over to you.
Hi there, everybody. Welcome to the National Patient Meeting. Thank you so much for being here. And thanks for joining me for this session on social media and how to best use it to strengthen our kidney health community. My name is Luke Schneider. I'm the managing partner at Alter Valley Digital. We're a communications and marketing company, and we've been working closely with AAKP, the American Association of Kidney Patients, on their efforts to grow this kidney patient community and advance some key policies too. We've been working with them for a little while here, and this national patient meeting is something we're really excited about because it's really incredible to get patients together and form this community, this genuine community where patients are sharing information with each other, they're helping each other understand their situation and their disease better, and they're organizing for political action as well. So we're really excited that you all are here and engaging in this community because it's a real difference maker when we all get together and share what we know with one another. So I'm here to talk to you a little bit about social media and how that could be part of your toolkit for how you engage with other kidney patients too. So when we're talking about social media, I found it really interesting that across all sorts of kinds of diseases, patients in America, 85% reported that they use social media to find answers to their health questions. 85%. I thought that was an amazingly huge number, considering that a lot of us only use social media, or we think so, for entertainment. So it was really fascinating to me that it's actually been used for a resource for health authorities and for patients who are looking for information too. But one of the gaps that I think we all see on social media is that sure, there are lots of health reporters, there are lots of government officials that use their accounts for this kind of information sharing. And there seems to be a little bit of a gap with kidney patients who are online, who are sharing their lived experiences. And as all of you know, These lived experiences are the best form of expertise when it comes to kidney disease and really any disease that we're going through. The ability for other kidney patients to hear from you directly, to hear from a kidney patient who has lived through this, it's very powerful, and it's important that we step in that gap as a kidney health community. So I really encourage you to consider using social media to reach some people that you might not know, or strengthen relationships with people that you already are in contact with. So if you do decide to use social media, the first thing that we recommend people do is try to understand and develop a better understanding of your own story. So what we advise that people do is spend a little time thinking over your whole kidney journey. Think about when you first found out that you or a loved one received your diagnosis, or think about what you deal with on a week-to-week basis or a day-to-day basis, and describe what are the specific things that you go through in terms of your logistics with your daily schedule, or how it feels to go throughout all of this, and what are the kinds of support that you seek out, and what are the kinds of activities that you find are uplifting, and kind of maybe make a bullet point list of some of those things that are important and integral to your story. And then start sharing that story with some people that you know, some loved ones who you trust, who can give you some feedback about the presentation of your story and the key elements that are compelling about that. And I think you'll learn a lot about your element as a speaker, and that I think you'll learn that you have a really compelling story to tell. And so once you have that story, take all of that and keep that as a living document. Revisit that story and make sure that you're updating it as you encounter people. Keep updating that story to find out what better ways that you can tell your story. And all of that is to further your readiness to be able to interact effectively on social media. When you have a good intimacy and familiarity with your own story, you'll be ready to engage people effectively whenever those moments come. So once you have your story, now it's time to engage in a network. And a few things that you can do is first make sure that you've got a good flow of information coming your way. Follow some good reporters and some news media accounts that are covering kidney stories, and the AAKP has a great list of those that you can find on their social media sites too. So make sure that you have good information coming your way, and follow other kidney patients who are very active as well. And beyond that, make sure you're following advocacy groups like the American Association of Kidney Patients, and sign up for their newsletter, and make sure you stay informed, and make sure you're registering for other kidney patient community events like this so that you continue to grow your network. And then once you've established that network and you have your story in hand, start to think about the frequency at which you want to engage online. You know, some of us wake up in the morning and read a few stories in some newspapers, or check out Twitter. But I challenge you that each time you're online, think about some kidney topics that could be salient for your audience, or think about some questions that you might have, and see if you can connect some other people with that answer as well. Each time you're online, challenge yourself to engage in this patient community and to be a leader in this community too. When we all challenge ourselves individually and hold ourselves accountable to step into this information gap, big things can happen, and kidney patients all of a sudden can be equipped with information they didn't have before. And importantly, when we share information with one another and we strengthen our relationships, it also feels like we have allies in this fight and that we're not alone. So I encourage you to engage online. I really encourage you to connect with one another throughout this national patient meeting. It's so important that we're in relationship together as a patient community, because big things happen when we're sharing information and we're connected. So thank you very much.
Thank you, Luke, for that insightful presentation. I know I was taking notes. I hope everybody that was watching did as well.